The key message of this report is that pharmacy is a professional skill. It allows pharmacists to offer quality health advice to patients, and that if we see pharmacists simply as people who dispense medicines, we're missing a major opportunity to improve the quality of healthcare provided by the NHS and to make it more accessible to patients.
The window of opportunity is open at the moment, but I'm not sure it's going to be open for that long in terms of developing sort of the new networks and models of care. And it's for that reason that I ended up calling the report Now or Never.
I think what this report does is to send exactly the right signals out to the pharmacy community to show them what's possible and actually what is necessary if we're to have a joined up, seamless and sustainable health service.
I work in the secondary and tertiary care setting. It would be inconceivable to me to do a ward round without having a pharmacist present in order to correct me, educate me and ensure that the patients get precisely the combination of therapies that I want them to have for the disease process that they have. Not to have that also mirrored in the community would seem to me to be entirely inappropriate, and I think again the report emphasises that this is the way forward.
There's a real value of being the pharmacists on the high street. They're near, they're local, they're accessible, they're knowledgeable. And people with long-term conditions often need advice outside normal GP hours. There's a perfect resource there. We're also often on many medications and things like that which they find difficult to understand, so there are real opportunities there. I think the pharmacists could do more as well. Education, general support, early identification, etc.
One of the problems with the health service is too many people find themselves going to hospital when they don't actually need to. If we're talking about relatively non-acute health condition, then there are a wide range of circumstances where pharmacists can provide professional advice to patients on the high street, close to their home, without them needing to go either to a GP surgery or still less to a hospital.
We're very keen and very happy to work with pharmacists, and the demands in general practice at the moment include multimorbidity, include many long-term conditions requiring polypharmacy, and if we have the expertise and help from pharmacy in terms of helping to manage these patients, particularly around self-care as well.
It seems obvious that there's a role for pharmacy in long-term conditions. So I think when we get the place of pharmacy in managing long-term conditions right, then I think there'll be knock-on benefits to social care. And I think the challenge to social care is how do we get, for people who have a long-term condition and a social care need, how do we regularly get all the key people in a room to discuss what's right for that person, what things are working well, what things maybe need to be changed. And I think it's really important that the local pharmacist is in that room.
I'm delighted with this report, and I and the rest of the English Pharmacy Board have made a personal commitment that it will not just sit on the shelf.